Hello and welcome all to a very special interaction on the theme Young Change Makers, organized jointly by Mimamsa Foundation for Indic Studies and Lokmaanya on the behest of National Youth Day organized by all of us today. National Youth Day is celebrated on the Swami Vivekananda Jayanti, which was started by Government of India in 1984, and rightfully so. Swami Vivekananda and his unwavering faith in young energy, in young Indians, in believing that they can make a noticeable and a very meaningful change in social and national life, has heralded a new vision for all of us today. Even his ideals, his vision continue to inspire a lot of us, and we can see that not only in our individual lives, but also social and national life. On the same theme, Lokmaanya and Mimamsa Foundation, we have organized a very special and a very different kind of interaction where we have clubbed together three dynamic young individuals who are working in a very different niche field, making some noticeable change today, and that too at the cost of their own individual careers, individual professional lives. At times their professional, individual and social lives even coincide. But when they coincide, they actually make a very interesting case for all of us to understand. And to understand those interesting cases, we have clubbed these three individuals. We have with us Tushar today. We have with us Dr. Aarti Bang and also Dr. Pareexit Shevde. We will come back to them in a minute's time. We will understand what kind of work they are doing and what change it is actually making in society today. But before that, we just want to introduce our individual forums to all of you. For that, I'll request Samhita to please introduce Mimamsa Foundation for Indic Studies. Samhita is founder and director of Mimamsa Foundation. Samhita, over to you.
Hello everyone, I'm Samhita. So Mimamsa Foundation for Indic Studies is an online forum which brings to you the authentic, well-researched and objective narrative which is firmly based on Indic value system. So we study India and Indian value system on the basis of four-pillared template. So what are these four pillars? These four pillars are Vijnana, Darshana, Itihasa and Sambhasha. So basically these four pillars represent India's rich scientific heritage, which is treasured in Indian knowledge system, philosophical, spiritual, theological thoughts, historical perspectives, and also political, social and economic discourses. We publish articles, special features, some interviews, and then documentaries on the subjects encompassing these four pillars by domain-specific scholars in English and Marathi. I request all of you to visit our website. The link of the website is given in the description box. I would also like all of you to visit and follow our Instagram, Facebook, Twitter, LinkedIn pages, and also YouTube channel, because some new events, articles, and video interactions are coming in upcoming months. Also, I welcome all of you on the behalf of the team of Mimamsa Foundation for Indic Studies and Team Lokmaanya. I also generously thank all our speakers for accepting our invitation and joining hands in the celebration of young spirit on National Youth Day and 150th birth anniversary of Swami Vivekananda. Thank you so much.
Thank you, Samhita. I now request Gauri, who is the founder of Lokmaanya, to introduce to us the Lokmaanya portal.
Thank you, Akshay. Hello, everyone. My name is Gauri Nulkarok, and I'm founder of Lokmaanya. So Lokmaanya basically is a trilingual multimedia platform which aims to highlight various stories of India and its neighborhood. So by India and its neighborhood, we mean the territory which stretches from Middle East to Southeast Asia and from the IOR to Central Asia. At Lokmaanya, we have three goals. One is to connect individuals, communities, and cultures within this territory through one of the most powerful forms of content, which is stories. Two, we wish to take complex topics and ideas to maximum people through simple and engaging articles, videos, and podcasts. And three, we wish to expand policy discussions beyond New Delhi and give the rest of India a stronger voice. At we truly believe in the potential and brilliance of our youth, and we are very keen to engage with them. So I'm very happy that we have partnered with Mimamsa today, which is a young and dynamic organization. And we are hosting Swami Shrikantanada of Ramkrishna Math and these three exceptional youngsters today on the occasion of the birth anniversary of Swami Vivekananda, which we also celebrate as National Youth Day. Lokmaanya is much more than just a media platform, and we would be very happy to collaborate with you in many different ways. For more details, or if you have any questions or suggestions, please drop us your email ID in the comments below and we will get back to you. Thanks, Akshay, and over to you.
Thank you, Gauri. Now, moving ahead, I think it's only opportune that we first understand from someone who has studied, understood, and has probably incorporated the vision and mission of Swami Vivekananda in their individual lives. And to do that, we have Swami Shrikantanada, who is the president of Ramkrishna Math, Pune. He is not only the president, but he's also a very prolific orator, commentator who you can read, who can listen to on various issues like Indian spirituality, Indian religion, Indian society. He speaks frequently on webinars, talks, someone who has organized these webinars for all of us. And today we are privileged to have him with us to give us the keynote address. I will request Swami Shrikantanada to please guide us about what Swami Vivekananda really expected from individuals and youngsters like us. Swami.
Dear friends, namaskar. I am grateful to Mimamsa and Lokmaanya Foundation for inviting me to share my ideas in this program. Swami Vivekananda is the ideal for youth because he lived just for 39 years. His life is, you can say, the perennial inspiration for younger generation. And Swami Vivekananda said, my faith lies in younger generation, modern generation. Out of them will come my workers. They will solve the problems of India like a lions. So Swamiji had tremendous faith in our younger generation. They will have to build this country. They will have to build their own character. What Swami Vivekananda expected. He said, I want nation building, character building, education. So our country needs such type of education where our younger people will get inspiration. Swamiji's idea should be introduced everywhere so that young people can do great things. They can achieve great things in life. I have composed a small poem based on this. ग्राम ग्राम अब निकल पड़ो तुम लेकर स्वामी जी की पताका, परहित में जो प्राण गवाता वही अमर हो जाता, जो स्वार्थ पर होता है वह जीते जी मर जाता, जय विवेकानंद हमारे, जय हो भारत माता। मन में साहस, बाहु में शक्ति, हृदय बसाओ भारत भक्ति, भूलो नहीं तुम भारत वीर, गरीबों से खून का नाता, जय विवेकानंद हमारे, जय हो भारत माता। रोना नहीं, अफसोना नहीं, अविरत आगे बढ़ जाए सब, डर नहीं है किसी शक्ति का, स्वामी जी हमारे नेता, जय विवेकानंद हमारे, जय हो भारत माता। So dear friends, this one poem contains all Swami Vivekananda's message to our younger generation. He says, go village to village and serve the poor people, needy people. They are Daridra Narayana, they are Rogi Narayanas. We have to serve them. We have neglected them so many years. We have suppressed women. That's why we have so many problems. So Swami Vivekananda is calling younger people to develop their character, to build up their character, to become great. At the same time, dedicate their life for the good of country. Swami Vivekananda says, they alone live who live for others, the rest are more dead than alive. परहित में जो प्राण गवाता वही अमर हो जाता, जो स्वार्थ पर होता है वह जीते जी मर जाता। I am very happy that Mimamsa and Lokmaanya Foundation is engaged in such type of activities. There they are trying to give this inspiration to our younger generation. And I am very happy that participants also are young and they are also trying their best to give their something for the society so that India will become great. Swami Vivekananda's idea was like that. So we want nation building, character building, education. But then what type of young people Swamiji wanted? He said, your country needs this tremendous sacrifice. Arise, awake, Your country needs this tremendous sacrifice. It is the young male who will do it. The young, the energetic, the well-built, the strong, the intellectual, for them is the task. So Swamiji wanted young people to make India great. But then he wanted young people, young, energetic, well-built, intellectual and strong. Such type of people alone can do great things. For them is the task. It is not for dull-minded. It is not for weak people. It is not for good-for-nothing people. So young people, first they should develop their wonderful personality so that they can do great work. You want to do work, you want to serve the country, you should have something to sacrifice. So first achieve all these great things in your character and then try to share with others what Swami Vivekananda expected. Bharat maa ko aaj jarurat लाखों हजारों नौजवान आए हो जब इस धरती पर माँ के चरणों में कर दो बलिदान. कायरता और मंद बुद्धि से नहीं बनेगा भारत का काम. भारत माँ को आज जरूरत शूर वीर और बुद्धिमान. Mother India wants sacrifice of shura veera and buddhiman, strong, energetic, well-built and intellectual. Such type of young people. Swami Vivekananda is there to inspire everybody. Swamiji himself said, I may give up my body, but I will continue to inspire people for 1,000 years everywhere. So that is Swami Vivekananda's inspiration. Swami Vivekananda inspired Miss Margaret Noble. She was an Irish lady, young lady. Swamiji inspired her. She came all the way to India. She dedicated her life for the service of India. Swamiji has given a beautiful name, Bhagini Nivedita. Bhagini Nivedita dedicated her life for the welfare of India and she became immortal. So like that our freedom fighters, Lokmaanya Tilak, Gandhiji, Subhash Chandra Bose, Arvinda, they all were inspired by Swami Vivekananda's ideas and they could sacrifice their life to make India free, to make India great. So in every field Swamiji inspired people. Even Jamshedji Tata, when Swamiji met him while traveling from Japan to America in ship, Swamiji told him, why you are importing everything from other countries? Why don't you start something in India? And taking that inspiration, Jamshedji started a science institute in Mysore. Today it is well-known institute in Bangalore, Science Research Institute. So every field Swamiji inspired people. That was Swamiji's greatness. So therefore we have to take these Swamiji's ideas. If we want to make really India great, we must take the Swamiji spirit and we must learn how to dedicate our life for the good of the people. Otherwise, what is the use? Achieving everything and not giving anything in return. So always in our mind, this idea should be there. Swami Vivekananda is there. He is ever ready to inspire us, to give us wonderful ideas. Even Rabindranath Tagore said, if you want to know India, study Swami Vivekananda. In him, everything is positive and nothing is negative. Mahatma Gandhi said, after reading Swami Vivekananda's literature, my love for country has increased thousandfold. So I request younger people, young generation, to read Swami Vivekananda's message, to read Swami Vivekananda's life, get lot of inspiration, have confidence, courage, boldness, fearlessness, all these great qualities Swamiji expected from our younger people. And above all, a good character, and then spirit of service and dedication. That is what Swamiji expected from our younger generation. So I am grateful to Mimamsa and Lokmaanya Foundation for asking me to share Swami Vivekananda's ideas with you all. So, and they are doing wonderful work and it must be appreciated. They are taking these ideas to the young people and participants also are young people. So once again, I am thankful to Mimamsa and Lokmaanya Foundation for giving me this opportunity. Again, once more, thank you. Namaskar.
Thank you, Swamiji. I think you have set the tone right. Our Prime Minister loves to talk about abbreviations, and if we can take 3 abbreviations, the 3S from Swamiji's talk today, it is service, sacrifice, and selflessness, which he has given to us. And our 3 participants, when we hear to them, I think we'll get the same tone from their speech today. So thank you, Swamiji, once again for joining us and setting the tone right. I'll take the discussion ahead now, and I think we all are waiting to hear what our three young change makers want to share today. I'll first want to begin with Tushar, and to introduce anything, Tushar is a young scientist. He studied in IIT Mumbai and then joined DRDO, where he worked on jet engines and for cruise missiles. During his stint at IIT Mumbai, he and his team also built and launched a student satellite named Pratham, which was on the top of ISRO rocket. He's also the co-founder of Manastu Space, a space startup building safe and efficient fuel and engine, a green propulsion systems for satellites. To also mention, he's also very deeply inspired by Swami Vivekananda and Advaita Vedanta, and he believes that is the integral part of his, not just his life, but overall approach to his life. So, Tushar, thank you very much for joining us. We are really grateful that you have taken out time. We want to hear from you. What inspired you to do what you are doing, and how that actually connects with Advaita Vedanta and Swami Vivekananda. Over to you, Tushar.
Yeah. Before we get into the topic, so I'd like to first thank Mimamsa team and Lokmaanya team. Thank you for organizing this event, and thank you, Swamiji, for it's always fun to hear about and enlightening to hear about Swami Vivekananda and anything related to any stories. And thank you for amazing poem by Swamiji. To start with, what we exactly do, we are an aerospace company doing building a technology which will make the satellites cheaper and all basically. But why we do, and so basically we get a lot of inspiration from Shravana, Manana, Nirandhyasana, and figuring out why you do it is the most important. Your bhavna, and that is what we learn from Swami Vivekananda. So for us, our company, that bhava is that we want to solve the problems on the earth using space. So that is including anything from deforestation, border security, food, crop, everything. And using our propulsion system, we want to reduce that cost, where we can solve the problems on the earth so that it can be reached to the last person. And this has been a very, very, the journey has been filled with a lot of, obstacles. Building a very deep hardcore technical company in India, where 99.9 people don't understand what is the space, and then getting into more detail about the hardcore technology that we are doing, it is really, really tough task. And so when we think about how to find a way in navigating through this, like a journey, it's a journey. Then obvious option came is like, how did Swami Vivekananda did when he was there, and how did he find his way? And for him, and we found a very, very similar match. Something similar happens with this Shivaji Maharaj also. How did he find a way to get the Swaraj? So while studying similar pattern with what Swami Vivekananda did to achieve what he achieved, we realized the very important role played in his part was obviously Ramkrishna Guru, his teacher, and the teaching that he taught. And that exactly teaching has been working for us very significantly. And the core of the Advaita Vedanta, as we are discussing, which is like you are nothing but a consciousness, and you are free from body and mind, and no problem of a body and mind will affect you once you understand, once you realize there's God. And so to tell you the story how this has worked, the exact Advaita Vedanta. So 1.5 years ago, we were building a technology for Indian Army, and the technology involved building a hydrogen balloon. And this balloon, and we were doing a testing. So this was to keep an eye on the border where the terrorist was entering, to keep an eye that where the terrorists are entering into the country. So for Indian Army basically, while building this product, we were testing this hydrogen balloon, and it was in my hand. And suddenly that 4-meter hydrogen balloon exploded in my hand, and I completely burned my face and my body. And suddenly, and then it was if you have seen any time a burn pain, you can feel what does that mean. And I was around my complete face, both the hands were burned, and it was around 16-20% burn. And in that moment, what helped me to be very blissful was the teaching from Ramkrishna Mission and Swami Vivekananda and overall Advaita Vedanta is that we are not a body and mind. We are this consciousness. So all this pain was in my body and mind. And so immediately, so something similar, Swami Ramkrishna ji had this cancer, and even then he was very blissful. That came rushing back, and that helped me to immediately be free from the body mind pain. And then that gave me, and that's how I realized the very, very true potential. Before that, I knew what was the teaching. That day, I realized it, and that has been. So that teaching about who we are and what is the role of a youth and what is the role of a technology to help the poor who are less fortunate from us has been a key role in our founding, our team structure, and our every decision that we make. And so, if people ask me who are the guru, of course the teachers who have taught me from the childhood, but the Swami Vivekananda has been one of the most pivotal guru in the whole journey, and will keep up doing the work that he has showed us, and some of the qualities that the concentration, the mind, the choice, the decision making ability, the practical Vedanta he has taught, those resonate like today more than any time ever, and so that has helped us in the process. So, and of course the technologies will do, but the thought behind the process has been a very integral part, and the technology for the poor is what we are doing to make this country safe and we make this humanity better. It's the central theme of our startup also. So thank you once again, the team.
Thank you, Tushar, for that wonderful talk. I mean, I can understand how this practice, sometimes we do not understand how spiritual and abstract things make a real difference in our real life, but you have illustrated a very good example when these so-called abstract things coincide and make us act in the real world, and they genuinely help us to achieve something bigger than what we aim for. Thank you. That was really inspiring, Tushar. Now from technology, let's move to society, and our next panelist is one such person who has completely dedicated her professional and academic know-how to make a real change in society. We have with us Dr. Aarti Bang. She works at an NGO called Search, which is dedicated to community health in Gadchiroli. Her areas of work include primarily the de-addiction along with mental health, especially for women. She's also working at Sankalp, which is again a de-addiction center for police personnel in District of Police Headquarters in Gadchiroli. She's a medical doctor by training. She has done her MBBS from Pune, after which she studied psychology and used that technical know-how to use in the places where probably we do not generally enter or even don't want to enter. But she is not only there, but making some real good work. And we want to hear from Aarti what kind of work she is doing and what kind of experiences she is getting. Over to you, Aarti.
Hello? Yes. Am I audible?
Yes.
Okay, cool. So first of all, thank you very much for inviting me on this platform. And I would also like to thank Swamiji for enlightening us on the talk. So I will directly like to go ahead with the presentation. So can I just share my PPT?
Please do it.
So I basically lead the mental health team here in Gadchiroli. I finished my MBBS from BJ Medical College in Pune in 2011, and after that I went for my postgraduate training in psychiatry, and I joined Search in 2016. So before I actually talk about exactly what we do here, I would just like to explain the context of where we are located. So this is like the most easternmost part of the entire state, and 40% of the entire 12 lakh population is tribals. And this is the organization. It's quite well known in the field of public health, It was started by doctors Ranade and Aarti Bang. And so why mental health? So in 2015, NIMHANS did the very first comprehensive mental health survey of the entire country. And they said that around 11.2% Indians are in need of active interventions, which is huge. And when you project this need, this 11.2% onto Gadchiroli, what we see is around 120,000 people in Gadchiroli are in need of mental health services, and Surge Hospital is the only mental health care facility for the entire district. So our journey has been that initially in 2010, we started monthly mental health services, wherein we roped in, I was not here then, so well-known psychiatrists from Mumbai, Nagpur, Chandrapur, they came here once in a month to actually see patients. From 2011 to 2016, this was regularized. From 2016, I joined and we started regular mental health services and OPD and IPD admissions. And now our team has grown to a team of 12 people, in which we have 2 medical officers, several counselors, data analysts. So it has been a very interesting journey from just visiting psychiatrists to a team of psychiatrists, doctors, counselors, nurses. And our main priority areas are psychiatric clinical care services, addiction disorders. We have very strongly identified with the need of treatment of alcohol and tobacco addiction in our district. More specifically, our third priority is tribal mental health, because they are a very marginalized community, and they, as you know, that in such a long district, we are the only facility here. And lastly is that we are seeing that suicide is an emerging mental health, public health need. So that is something that has become our priority now. So we provide our services through these 4 main programs. The first is, like I said, the psychiatric care services. So this is how our hospital looks like. It's a very, very community-friendly hospital. It doesn't have it encourages people to sit, chit-chat, and make them feel close to their homes and their communities. So in 2016, the year that I joined, the consultations were just 801. And in fact, I was worried that if people would actually need mental health services, because it's a very niche service, it's also very specialized service. And my idea and my assumption was that people here would not need mental health services, but I was proven wrong. So the mental health consultations have just increased every year. And we see the entire spectrum of illnesses. We see psychiatric disorders in the sense of schizophrenia, psychosis, anxiety, depression, addiction. Addiction forms a very important component of our clinic. Addiction, anxiety, and depression. So regarding the next priority and challenge area for us is the treatment of tobacco and alcohol use disorders. In simple language, what we call as alcohol dependence and tobacco dependence. So Surge, the hospital, the organization that I work with, it conducts the annual alcohol and tobacco survey every year since 2016. And in this, we estimate the number of males who drink alcohol, the expenditure that they do on alcohol and tobacco combined. So it has come to our notice that 36,000 males have a problematic pattern of alcohol use. And here I am not giving the actual figure of males consuming alcohol is huge. Out of that figure, I have just taken the amount of males who have a problematic pattern of drinking, which is drinking and driving, drinking and having who inflict domestic violence on their female counterparts. So this is a huge problem. And also that people spend close to 340 crore rupees on alcohol and tobacco combined. This was more than the development budget of Gadchiroli. But the silver lining was that 45% wanted to quit. And so we designed a community alcohol addiction management program, because as you know, Gadchiroli is a very long district and people often did not reach our hospital. Or as we know that there is so much stigma related to mental health problems and addictions that patients will not very eagerly and willingly come to the clinic. So we decided that if patients cannot come to us, we will go to their communities and to their villages. So that was the rationale in creating Mukti Rekha, which is our community-based district-wide alcohol management program. So this is our team. And they are very motivated. They do an amazing job. So there are some villages which are so cut off from routine roads that they actually have to travel by small boats called dongas. So here we see our driver who is carrying a box of medicines and our counselor who has a bag in his hand. So they do this journey every single day. And it has been an enormous learning experience for us as a team, and to actually so empowering to be able to reach so many communities. This is how the registration process looks like. So we usually, one of our counselors or Sayojaks would reach that village 2 days before and decide on a place where we could take the camp and organize the local community, because we do not charge anything to them, but the village, what it does in return is provide all our team with meals, food, and a place to conduct the camp. And these are our counselors. The one in the white hair, he is our oldest peer counselor. He started his journey at Search as a patient of alcohol addiction, and it's been 27 years that he has remained off alcohol. So that is how our team is. And this is the group therapy in the morning. The next day in the morning, he would usually conduct some yoga sessions. And on the left-hand picture, you would see one of our master trainers, he is having a group therapy session. And these are the follow-up meetings. So we will not leave the village by just conducting a camp. We will have a follow-up booster visit again at 1 month, at 3 months after the camp, at 6 months after the camp, to keep a check on how the patients are doing, if they need any more help, any more assistance or referral. So we started this in January 2019. And the data that I have right now is only actually till December 2019. So I have not included the data since Jan 2020. But already 1,200, close to 1,200 patients have taken care. And we are seeing really good follow-up outcomes. Now, this is block addiction management clinics. So initially what we saw was village camps, but then we thought, let us also have a second tier, which would be having more specialized, more trained counselor at taluka level. And what they would do is that there should be a routine facility, counseling clinic facility available even when the camp is not there, for patients to come and get themselves checked, or if they want to take any counseling services, so that should be there. And counseling clinics are also provided supervision and diagnostic as well as therapeutic facilities by myself as a psychiatrist and the medical officer who is with us. On the left-hand side photo is Dr. Sudhir Bhave, who is one of the most leading psychiatrists in Nagpur. He was the one who actually inaugurated our counseling clinic at Gadchiroli. And so this is data of our block counseling clinics. So again, as I said, that the data is just Jan to November, but the response is just enormous and people are really benefiting from these counseling clinics. And coming to the third priority area, which is tribal mental health. And here I am emphasizing tribal part is because when we say that we are providing treatment for alcohol addiction or hospital-based psychiatric services, it is available for everyone. But because we are in Gadchiroli, we are stationed here, and tribal communities are really marginalized. So we thought we should do something that will be specifically targeted for them, and also that because they don't come to us again, that we have to do something that will ensure they actually seek more care, so we can change their care seeking habits. So to begin with, we started with research. So to first understand what is the need and what is the burden of mental health disorders in tribal communities. So these are some of the pictures from our first mental health survey. Let me tell you, it was one of the first of its kind in India, where a mental health survey was done in an exclusive tribal community. And there is the first of its kind report that was published on tribal health in India by the expert committee appointed by the government of India, and they have also underscored the importance of having measurements in tribal communities and developing solutions for them. So in our study, we took 48 tribal villages and we actually administered the survey on around 2,000 people. These are some of the pictures from the survey. So it has come to our light that depression, anxiety disorders are hugely prevalent. That what the common understanding is that there won't be mental health issues in tribal communities, that they are very happy is misleading. That they have problems, it is just that they don't really seek care. And hence, the last point is regarding suicide, in which we have noticed, I have circled in red on this Excel chart, in which we actually keep a note of all the possible causes of deaths in our communities. And it has come to our notice that suicide accounts for 4.5% of all deaths, which is actually more than snake bites, which is quite common, and in fact malaria. And so we have decided as our next challenge will be reducing suicide in the tribal district of Gadchiroli. The significance mainly of our work is that we are the only psychiatric care facility for the entire district, which is regular, and I'm so sorry. Which is regular and which also has medical officers and counselors available. We continue to take up new challenges according to the emerging needs in the community. And regarding the alcohol and tobacco community-based program, I would say this has the model that Search and our team has developed is very novel. It's evidence-based, and it has broken the boundaries of care being available only in clinics and hospitals. So I think this has been an enormous contribution of our team towards addiction disorders. So thank you, that's it.
Thank you, Aarti, so much.
Yes.
I think it's phenomenal work. I mean, I understand that this time limit is very small to actually explain a lot of work which you are doing, but I think you have given a very wonderful idea. And I'm sure we all would like to visit your clinics to someday and see how wonderful work you are doing there.
Almost well.
Great. Now next, from technology to society, and from society to again ancient technology for the betterment of society, we have with us Vaidya Pareexit Shevde. Vaidya Pareexit Shevde is a renowned Ayurvedic physician. He's also a very popular public speaker, and he's also an author. If you have been following Marathi news channels, you will often see him debating on a variety of issues. He's founder of Shri Venkatesh Ayurveda, which is a chain of authentic Ayurvedic clinics. His postgraduate degree is in the research on Ayurveda and Kama Shastra. and he's one of the very few clinicians who is representing this field of Ayurveda. He's also delivered more than 500 public lectures regarding Ayurveda health history. And also a very notable aspect that he is also author of 8 books in Marathi, which range from history, health to social issues. We are really happy to have you, Pareexit, with us. I mean, the broad range of activities which you do itself is very inspiring. I'm sure the work in terms of representing a modern face of Ayurveda in society today is even more inspiring. We want to know more from you. Please, it's over to you now.
Thanks a lot. First of all, my pranam to Swamiji. My sincere gratitude to both Mimamsa Group and Lokmaanya Foundation for organizing such a wonderful event. And I'm really happy to know other panelists and the enormous work they are doing in their individual field. So it's a great feeling to be a panelist along with them. Having said that, I think that I represent here the ancient most medicinal science, and not just the medicinal science, in fact, the science of life. Like the word Ayurveda itself tells us about Ayusho Vedaha iti Ayurveda. That means it is a science of life. Perhaps the ancient most, which has developed all the other possible medicinal branches which are existing even today. The medicinal science which actually took care of Indians, and not just Indians, to be precise, the people or the civilization which was there in entire Aryavarta. But then, because of the major invasions that we faced, it was damaged at large. In initial invasions, like those are Islamic invasions, the texts were burnt, the knowledge were stolen, it was smuggled. Like there were texts like Kashyap Samhita, which were found directly from Nepal. It would be, you would be quite shocked to know this, that we were not having that text, the entire text which was dedicated to pediatrics in Ayurveda. So God knows within this time period particularly, how many of its knowledge was burned practically to ashes. Afterwards came the Britishers, which practically didn't allow the Ayurvedic practice to take place, or in fact, they punished Ayurvedic practitioners at that time. There are quite many gazette records of British era, which are quite evident of this thing particularly, which I am sharing with you all. The same thing happened in the colonial mindsets of that of Portuguese or French, wherever they were ruling in the small parts of India, like that of Goa or Diu, Daman, Vasai, etc. So after all these atrocities, there was a huge damage and a setback to this medical science. And then, of course, came the question that generally today, even today, unfortunately, there is a picture that why people take admission to Ayurveda is basically because they are not getting admission to MBBS. So thankfully, I am one of that category of the group which actually wanted to take admission to Ayurveda to learn it. And that's why my journey started from learning pure Ayurveda. Then I did my post-graduation as mentioned earlier. And my post-graduation is also from basic principles of Ayurveda because I wanted to learn the depth of this science. Of course, learning is a constant process and we are still in learning. But the time changes and the things change. And similarly, we observed, all of us, in fact, we observed that change during this COVID-19 pandemic. Of course, we shall come to that topic soon, maybe or sooner or later. But I would like to tell you or share you with this particular extensive phenomena that during this particular pandemic period, there was a huge surge of patients in pure Ayurveda OPDs. According to the NIA Jaipur, the survey conducted by them states that almost 30% of surge in Ayurvedic OPDs, the patients were actually seeking for pure Ayurvedic treatment. Now, why this happened? Because initial research told us about the immunoboosters. And of course, this is a well-known thing that Ayurveda being a great in immunobooster thing. But then people like me realize that, merely selling products in terms of immunity or the immunoboosters is not sufficient, but to create awareness regarding it is at most important. So what is the exact definition of Vyadhi Kshamatva, which comes from Charaka Samhita originally, and which is actually loosely translated these days while using it as to be immunity. Of course, I'm not talking about the concept of immunity, which is described by modern medicine. It is entirely a different concept and a very detailed one. But My point is the loose terminology or the loose translation which is being used about the Vyadhi Kshamatva. So that's where the people started coming to Ayurvedic clinics to take treatment. And then there were ample of patients in various categories. There were mild symptomatic patients, there were moderate, there were high risk patients, there were patients with comorbidities. Then comes the group where there was pneumonia, which was considered to be the deadliest cult of this pandemic. And then there were patients to whom it was suggested that you would be kept on ventilator pretty soon, and they turned to Ayurveda and got excellent results. So I belong to that group of physicians who believe in providing Ayurveda to a larger population, making it available in a cheaper way. But on the similar side, we have to make it sure that we are talking evidence-based. So all what we done, me and physicians like me, I personally shared my COVID-19 protocol of treatment with 130 other physicians, Ayurvedic physicians in Maharashtra, so that they would judge it on their behalf as well. And they started serving society on those grounds also. But we have kept all the substantial evidential data. My own couple of papers, the research papers, are in process of peer review. Let's see when they would get published, but whenever they will, it will be all in front of people. But what we understood or we learned during this process is that actually we are limiting ourselves at large, the Ayurveda physicians, and actually we can push those limits further. So even patients realize that they saw the clinical results in COVID and afterwards, even in post-COVID cases also. And then the scenario started changing at large, that now most of us are getting cases which are actually considered to be either terminal or non-curable as per the conventional medicine or the Western medicine. See, actually what happened is, particularly in British era, as I said, there were atrocities as well as there was complete brainwash of Indian society as well. The similar thing was done about our own educational system, and Britishers replaced it with their educational system. Similarly, Ayurveda was replaced by the Western medicine. And even after Britishers were gone, their followers are still there, who always run behind one particular branch of medicine. It is so unscientific to run behind one particular branch. See, I am not against any branch. None of the medicinal branch is useless or which is bad for human being or something like that. The only thing is where to use and when to use and how much to be used. So accordingly, we made the bifurcations and started working. And nowadays we are finding that right from diabetes to chronic renal failure to malignancies, commonly known as cancers, there is a surge of patients which are turning to Ayurveda. Shri Venkatesh Ayurveda is a very small kind of organization. We have got 3 branches. One is there in Mumbai, another one is in Chipadun, and third one is in Goa. And we are trying to serve people with authentic Ayurveda, keeping all the relevant records. I'm one of those practitioners who keep working on ground and also speak about it. Because generally what happens, that those who speak, they don't work. And those who keep on working, they hardly speak. So I'm just trying to fill up that gap in between doers and speakers and maintaining the balance in between both of them, resulting in public awareness by the means of social media. So that's how it is. So far, this kind of work is going on. I would once again thank you for having me on the panel. Let's discuss things in more details, maybe in coming time. Thank you.
I want to ask Aarti also, because when we were looking from the presentation which Aarti you were giving and the kind of work that you were doing, I was just intrigued by one aspect that, you are an MBBS doctor. In a conventional thinking, you had a promising career in front of you, a well-settled career, as they say. Yet you chose a very less trodden path. You are working in an area where people don't generally go. It is sometimes assumed as a thankless kind of a job. Do you ever feel dejected, or do you ever feel that, probably you should have opted the conventional route, or do these thoughts bother you ever?
Now I realize that the kind of joy I am getting in creatively designing the mental health program from scratch, that is an opportunity very few young professionals get. So there was no team existent here, and I totally get to do everything from scratch. So that is awesome. And so professionally, it has been very fulfilling. And regarding my personal life, I definitely like to go out, and I am a big foodie. So I get to do that whenever I go either to my mother's place in Nasik or when I go out for conferences. So I am really getting the best of both the worlds. So no.
Tushar, I mean, I was also listening to you and building satellites, low cost fuels. This is the kind of stuff, as you rightly pointed out, 99% people don't understand. Was it always your dream to do it, or there were some inflection points in your life, that changed? Okay, now this is my career is going to be, because how many? I mean, as a 8th or 9th standard student or a 10th standard student, I knew very few careers, and acting was one of them. But building satellites probably is very, very unique. How do you come about that?
I was in 5th or 6th standard. Typically, the teacher was going around the classroom asking everyone what do you want to become, and so everyone was like doctor, engineer. I was like, nah. I said I wanted to become scientist. Absolutely, I didn't have anything in mind. Okay, I didn't know what exactly. I mean, of course, apart from Newton and all those people, didn't know exactly what all scientists do. Of course, they do some kind of science, but what kind of scientists, no idea. Parallelly, my father was in HL. So he's working on a Sukhoi and MiG and all those discussions since childhood was going on in the house. So we used to have a calendar which used to have the photos of all these helicopters, fighter planes, and all those things. So those things used to keep falling on my ears when I was a kid, and then that one thing led to another. And when it came to taking admission into IIT after getting the decent rank, I said, okay, yeah, this is something I wanted to do, aerospace. That was a branch they started. But once I got into aerospace, then I was going through the website of the department and I was looking through, and then I found that there's something interesting. There is the student in IIT Bombay were doing something interesting in the department. They were building a satellite. I was like, this was 2009 basically. I was like, we have heard students doing car, robot, but satellite is something very interesting. And that's when I decided if something I wanted to do in IIT, this is the one thing I wanted to do in IIT. So in the first year, I didn't do anything. I just played cricket and lawn tennis, and I studied for getting into the satellite. And at the end, after first year, I got into the satellite, and then in the third, fourth year, I was a project manager. So I was project manager involved, raising money, talking to ISRO, convincing them to put your 2-3 crore rupees satellite onto the top of 300-400 crore rupees ISRO rocket. That was some task. I've been getting work done from kids who are like IIT. We have with the full of so many things like extracurricular activities, without paying them any salary, any single rupees or any grade, asking them to build a technology which will ISRO approve, and we know what the ISRO standards are. So we learn a lot of things about the leadership also in the process. So technology, the leadership, and so then this one thing led to another, and the aerospace and all those things led to another, and they said, okay. And in 2016, our satellite actually got launched onto the top of ISRO rocket, and since childhood, before we say the acting, everyone's dream is to become astronaut. If I'm not wrong. So, and we used to see the rocket getting launched, and that was one of the fancy things. And that day, our dream got actually fulfilled of building something and launching it into the space on the top of ISRO rocket, which was going up. And that day we realized this is something that we wanted to do the rest of the life.
Interesting. I mean, we've seen satellites being built in movies, and then the Shah Rukh Khan entering again and doing a Swades. I hope you're already doing that here, and I'm sure. And it's interesting when you mentioned in your opening remarks that the application of your satellites range from national security to actually predicting the rainfall, and which are directly linked to individuals' life. And I think commendable work. But again, I want to ask Pareexit. I mean, we've seen, we have listened to your individual remarks and opening remarks, but we've also looked at the range of activities you are doing. I mean, apart from your demanding schedule for practice, you're also authoring books. You are giving public lectures. You are on news. You are on social media. a very fundamental and question. How do you get time? How do you manage your time? I mean, is it a 48 hours day there?
No, actually, you manage time when you will to do certain things. And to be very frank, when I look back at our history, the same question comes in my mind: how Chhatrapati Shivaji Maharaj got the time to create that huge Hindavi Swarajya at that time, which no one would have thought at that time. How Adi Shankara did Bharat Brahman, the Aryavarta Brahman. How did he get to the Kashmir Sharda Pitham and did all the Vad Vivad, etc., what he did for the sake of Dharma? Then the question in my mind comes, how did Swami Vivekananda get the time? So when we think about all these things, we realize that, it's all about the passion that you have got. And I must say with these regards that specifically we are blessed. Again, this is not a political statement or something like that, but yeah, that is the reality, to have a prime minister who's working that much for the country restlessly. So I guess as a youth of this country, itna to banta hai that we should take time for that. And this is our duty entirely. That's what I feel, to pass a certain lineage to the next generations regarding their rich history, their rich heritage, their culture. And that's how, not the 48 hours day, but yeah, whatever time I'm getting, working in that day and night.
Coming back to Aarti, I've also listened to your interviews where you very emphatically say that drinking alcohol, even for as a pastime or occasion, is poisonous enough. You would be, going against a lot of youngsters. You will be, they would probably be against you, saying that. But you don't really say that. You also make a very scientific case for it. How do you approach? How do you convince people on this particular ground? Have there been many difficulties on that? How do people receive this kind of demand, very unconventional and unpopular demand?
So this is a very interesting question, and so people often argue and they say that I am being very conservative in my views, etc., etc. So the first is that the science says it, I mean, so full stop. So till now, we did not have a lot of evidence, but with the latest global burden of disease study of 2017-18, they have shown that the safest level of alcohol is 0. So that is the first thing. Before that, it was very difficult because people would often say, "Par occasional se kuch nahi hota hai," etc., etc. So I think to a very large extent, science has been a friend in this. Very good evidence-based studies. And third that I often like to share sometimes is the kind of heart-wrenching stories that I have heard in my OPD countless number of times by the women who have literally cried their hearts out. And when you treat patients of alcohol addiction, even themselves, the patient themselves, it's a very bad end to their lives.
Right. Tushar, coming back to you, I mean, I was just like I was saying a while back that, your application, the work of your application is varied. I mean, from national security to probably individual security or human security in terms of floods and so on and so forth. Are there any more projects lined up for you? What are your future plans? How you want to evolve? How is your Manastu space planning your future from here? Can you share something about that?
Yeah. So very simple. We want to develop a technology so that the cost of like a mobile for the Geo, they brought in the reduce the cost of mobile internet or internet access in general to people, common people. So we want to reduce that access. I mean, so that everyone can get a benefit of a space for every common man. And all our technologies that we want to build and we are building will be towards that goal. And interestingly, India plays, because this is when you say the space, it's a global basically. You can't say the space, I'll do it only for India. That does not make sense. So for us, the Vasudhaiva Kutumbakam, straightforward. So and India especially has a lot of potential to offer in terms of a lot of things, because of the cost benefit, India can offer, which no one can match except say maybe China, in terms of cost benefit that can have, like ISRO has demonstrated multiple times. More than that, India has people trust India in terms of geopolitics and in terms of overall general, and a lot of CEOs in multinational are example that people trust India. So once you are dealing with them, especially when you are dealing with the technologies for defense and aerospace, that part plays a role. So India has that role to play, very, very significant role to play. And so in Manastu space also, at Manastu space also, our simple funda is that we'll develop the technologies that will solve, that will reduce the cost of access to the space through different technologies, so that it reaches the last person on the
discussion. We understand one thing, that whatever we do, we just have to do it committedly in a different way. I think Robert Frost said it very wonderfully when he said that two road diverge in the woods, and I travel the one which is less traveled by, and that's had made all the difference. And I think this we can see from these three cases as well, that they have chosen their path. There have been difficulties for all of these three people, and they probably found the answers to them within themselves. This is what I think is the best message we can take back home today, that we don't have to do grand things necessarily, but we have to do simple things in grand way. And I think we can make a difference in that particular aspect. Thank you, Tushar. Thank you, Aarti, and thank you, Pareexit, for joining us. We really, really appreciate that. Thank you all of you for joining us as well.